is a grad student here, FSU PhD student, Tonya Nascimento.
Well, first of all, Dr. Evelyn, I appreciate that spiel there, because I'm in a stress class, and several people in here are, and that's a nice review for our exam. I'm going to be talking about the psychological experience of athletes with vocal cord dysfunction. Come on in. I'm going to first start out with explaining what vocal cord dysfunction is, because it's not very well known. And then I'm going to move into what my actual study was and what I did, and finish up with what those findings were, which are the psychological aspects or experiences of an athlete with this. So as I said, what is vocal cord dysfunction? I'm looking for a comfortable spot to stand. First of all, it's an asthma masquerader. It is frequently mistaken for asthma. As we look here, we're looking at people presenting with upper airway obstruction. 3 different studies there. Not sure about the number of patients in this one, it just wasn't clear. But of those people presenting with those symptoms, we found that in the first 2 studies here, 10% actually had vocal cord dysfunction, and higher numbers when you include comorbidity of VCD and asthma. And down here, this exertional dyspnea is difficulty breathing with exercise. We found out that 15% of these patients had VCD. So it's frequently mistaken as asthma. In my study, all the people that I interviewed had been first diagnosed with asthma and found out later that it was actually VCD. What's the difference between the two? Well, this is exercise-induced asthma. This is exercise-induced vocal cord dysfunction. And essentially, the asthma is a chest tightness, as opposed to the throat tightness. That's really where it comes from in VCD, upper airway. So you'll see in asthma that you have expiratory stridor, which means a wheeze or a sound on the exhale when you're expirating. But on the VCD, it'll be on the inhale. It'll be this high-pitched whistle because the air is having difficulty getting in. Also, there's often coughing associated with the VCD. Asthma untreated can take 15 minutes to an hour to resolve. Much less time for VCD, 30 seconds to 5 minutes. But unfortunately, while asthma is easily treated with bronchodilators and other inhalers, VCD does not respond to that. And so even though it will resolve itself, when they immediately resume exercise, the same problems kick in again. Okay, additional symptoms, that's what it feels like. Additional symptoms for VCD is muscle fatigue, associated with lack of oxygen. Skin and lip color can visibly change from blue to purple. You can see that in the athletes. From regular color to blue or purple. And there's a sensation of feeling choked. Someone said they actually feel like someone is literally choking them while they're exercising. It was a qualitative study where I did interviews. This is a quote from one of my athletes, said, like if I try to push myself past the limit, I can't breathe at all, and I can't recover. That's the worst part. So I think it's critical to study this with athletes because obviously that's very detrimental to performance, depending on what they want to do. So when we look at it, this is a picture of the vocal cords if you were to look down on them with a scope, with a camera. And so we're seeing both these pictures are on the inhale. The normal is this one right here, where they're open, allowing all the air in. But the abnormal, someone with VCD, they're shut, and you can see this classic posterior chink here, which is allowing just a little bit of air to get in. And that's why you get that high-pitched whistle sound. It's getting squeezed into a small spot. So the vocal cords are either completely asynchronous, where they're closing like that when they should be opening when they're closed, they're just off, or they're slightly off. It's not completely, but just out of whack. This is looking at a pulmonary function test, and what you see here is this is on the expiration. So they're when they try to breathe in, and it gets stuck. So over here is the normal, a nice full loop for when you inhale, and over here we have it truncated. So you're just not getting as much air in, and you can see that. So that's one way to test for it, is to do pulmonary function test. But the gold standard is direct visualization during a symptomatic period. with a laryngoscopy or a bronchoscopy, actually sticking a scope down the nose or mouth and looking at it. So, my study was looking at what's the psychological experience of an athlete with vocal cord dysfunction. What is it like to have this? As I said, there's no cure. So I interviewed 3 swimmers, 1 field hockey, 1 soccer. They were all high level, Division I college, near Olympic level. AB level swimmer was not as high, but apparently among her peers, she was one of the fastest. A range of diagnosis of gaps in how long it had been, since we have age first diagnosed 13 to 27 here, but then I had one who had just been diagnosed a year before and one that had just been diagnosed 3 years before. So kind of range there. Of all these athletes, they were all high achievement, oriented towards success, intolerant of failure. This is from the literature. I found it in studies on it, but I also found it to be true of all the people that I interviewed. So I was able to collapse the data and look at them as one group, because they all seem similar in this sense. Just an example to illustrate this, she said, I never stop. How do I put this? I have to be forced to stop. I have to be dragged out of the pool or else I'll keep going. Just to illustrate this really just determined attitude. So what causes it? There's all these different ideas. It's really a mystery. But I guess none of these seem to be true or were true of the ones I was looking at, except perhaps, we don't know, an allergy to chlorine. Perhaps that affects some of the swimmers. Also gastroesophageal reflux. One of the athletes did have that, and she got treatment for it, and that didn't seem to help. But that's one of the things that happens. It might be that all of these are true, and some have it and some don't, but I was interested particularly in athletes, and particularly in exercise-induced. They all had it just during exercise, and it did not spontaneously occur at other times. This disorder has a history of being called fictitious or malingering, which means they're faking it. It used to be called, those are actually the name for it. It used to be called that before they called it VCD in 1983. At least among, I mean, that might be true for some, but at least among athletes, they can say it's probably not faking it. These athletes don't want, especially taking into consideration the characteristics, they're not using this as an excuse. They really want to succeed and their determination. So from what I was looking at, I don't find that to be a valid cause. Somatization and conversion, there is a correlation with depression, anxiety, with this disorder. Don't know if it comes before or after, so can't really say if it is a conversion disorder. How many athletes does it occur among? Well, don't really know, because it masquerades as asthma. We'll probably have a lower number than it actually is for prevalence. So they say greater than 3% due to misdiagnosis. This study said 5%. Don't really know. Looking at a 2007 article in USA Today, it said they screen all their athletes who come with asthma, because you have to be able to pass in order to use your bronchodilator, your inhaler. So when they screened all these athletes who came with an asthma diagnosis, they found that of the 2004 Olympic team, 8% actually had vocal cord dysfunction. That's a pretty high number among those athletes. And they also interestingly found it was an equal number of men and women. We normally find in the general population that there seems to be affects more women than men. But perhaps if everybody was tested, it would be equal, so we don't know. Sure. So what's the effect on sport involvement? This is actually from the athletes in my study. One had to end her career, extended breaks, the whole season, several months, 6 months or whatever. Switching to a new sport, one athlete switched from swimming to field hockey. Adaptations to training, which could be a whole other study, a whole bunch of that. And needing a longer recovery. These are the different treatments that are given, but as I said, there's no efficacious cure. So what can we do? Well, we can look at ways to help them cope. And so that's why I was trying to look up the psychological factors of the experience so we would better know how to help them cope. I did 2 in-depth interviews with them, including my personal journal is a heuristic phenomenological study. Interestingly, nothing that I found in my journal was different. There were no unique identifiers. It was all found also in the interviews of the other athletes. I was interested in their perspective and experience, not concerned with how objective it was. It was all perception. And then took, according to phenomenology, an inductive coding of the themes from the data. So let's see what I found. These are all the different psychological facets that I found for athletes with vocal cord dysfunction. Emotional exhaustion, frustration, aggravation, mood changes, feelings of isolation, chipping away at self-confidence, denial, this no fear, athletic identity, and unfairness. And to give you a better idea what those mean, I have a few quotes from each, and then I'll go through the smaller essences or themes underneath it. So for emotional exhaustion, they said psychologically I'm just exhausted from doing it and everything that goes along with it. Pretty much traumatic situations with my trainers, and I just can't do it. It's painful living with it. It's pure hell. I hate it so much. I mean, I was out of the pool for 6 months. You can imagine athletes trying to make it and they get stopped. By the end of the school year, this is a mother. By the end of the school year, I thought we were losing her. She was so depressed, and she'd never been like that. She's really hard on herself. It was horrible. So you can see some of the characteristics in there, too. She was anxious when it started because she was trying to make her junior cut, and she was putting a lot of pressure on herself. And then she had a couple episodes, and then a full-blown one, and then she went downhill, and it devastated her. So yeah, huge life changes since it all started. As I said, does the depression come before or after? Don't know, and we couldn't tell from my study, but it was found. Feelings of isolation, they don't understand because they've heard of exercise-induced asthma, and they ask, are you using inhalers? Why don't you do this or that? They don't get it. It can't be fixed because obviously I would if I could. So there's this feeling that nobody understands. And unfairness. Why isn't she as bad as me? This is one swimmer who had a teammate who also had it. She said, why isn't she as bad as me? And I really don't know the answer to that. Don't know. Maybe because she doesn't push herself to her maximum. So there was this idea that it only occurred in sprinting. Maybe they could manage it in pacing if they took speech therapy. Maybe they could manage it in other ways, but only when it was a lesser degree. Once they went up to their elite level, really tried to push themselves, they couldn't. They could never get to the pain barrier. The soccer player called it the turnover point, where you just don't feel the pain anymore. So these are just the small themes underneath. These are all those major themes that I already talked about. And underneath each one, it gives a little bit better idea of what it means. So I kind of talked about here, others don't understand, they don't believe, parents don't believe, they don't understand themselves. Emotional exhaustion, they question the benefits of loss of enjoyment, constantly defending yourself. Frustration was just not being able to keep up with others, not being able to keep up with themselves. Mood changing was an onset or worsening of depression or anxiety, and greater mood fluctuation just depending, they felt a loss of control, not knowing what was going to occur or not. Chipping away at self-confidence, that's because they started to see less success in practice or meets, and they questioned their ability. And they also felt out of shape, perpetually out of shape. Denial, no change because of the likelihood of attack. This was a very interesting point. Expected to see more fear or more anxiety. Actually, they seemed to think, they seemed to just ignore that they ever had it and attack just the same way and be surprised every time. So they never changed their verbalized self-talk. They always said, I can do it. No, I'm still going to do it. I'm going to succeed. I'm going to do well. But they did start to question their athletic ability of an athlete, and one explored other areas, to try to branch out from maybe swimming's not my thing, maybe I'll do something else. The question of athletic ability was, am I still an athlete if I'm not performing where I should be? And the unfairness was low tolerance for injury complaints for teammates, like, okay, well, you say you're hurting, your shoulder hurts or whatever, well, that's not as bad as what I have. So we look at this. These ones in black and brown here are all those that were found in the literature that match up with burnout. So emotional exhaustion and sport devaluation is associated with burnout in the literature. Mood changes, depression, feeling down, a lack of social support, stress in social relations, chipping away at self-confidence, that reduced sense of accomplishment, and a questioning sense of self as an athlete. So we say, okay, they look like they're at high risk for burnout. But then on the other hand, we've got frustration and aggravation where they're not able to keep up with others, but that seems to be paired with the determination to do it. That doesn't match up with burnout. And also, this denial, no fear, this belief it won't happen again, and they attack it the same way, which also doesn't match up with burnout, but makes sense if you think about the characteristics or personality of the athletes that seem to be most associated with this. And then that unfairness is this idea, why me? And of course, we don't know the answer to that. But what we do know now is who's usually affected, and from this study, some of the facets of the experience. So we know, at least with athletes, it's probably not malingering or fictitious. It's real. It's something they need reassurance. They need us to believe. They need, the doctors, this is their first case. And they're going, I don't know what to do. Isn't this interesting? You have this. So they feel just very isolated, alone, unusual. So the more people that know about it, the better. Which is one reason why part of this is just to raise awareness. The more people who know, the more we can realize it's out there and help. So awareness of the disorder, showing compassion and understanding of the athletes who have it, I think is very important. And possibly we can use the strategies for preventing burnout with these athletes, since there seems to be, that was not for my study, but many of the facets seem to line up with burnout literature. So maybe we can look at some of those coping strategies and see how that might help. And of course, encourage their dreams, because they're all high aspiring, but realize they may be more determined than realistic. So you've got to have the coaches, the sports psychology consultants, the trainers getting in there and maybe stopping them, making them face what's happening to them. Okay. That's what it feels like. So I think I'm out of time.
Thank you very much, Tom.